My name is Janet Wildman. I'm an associate at Horizons, and today, welcome to everybody who's joined us, who's on the telephone or who's just logged in. Welcome to EdgeTalks on the 8th of September, and we're looking at radical redesign and disruption, the next frontier for social prescribing. A fascinating subject that I know is going to feature in a lot of conversations going up to Expo. So here I am. I'm going to be helping to share the session today. I'm also joined by my EdgeTalks team, Lee Kendall, who's going to be our Twitter monitor. We're going to be hearing from Lee later on today. She's also in the chat room if you need to speak to her. We're also joined by Paul Woodley, who's also been helping us out, as you know, on the supporting the polls. But any technical support you can, contact Paul and he'll make sure he answers all your questions or concerns. So if you are joining in today and beyond, why not, again, contribute through the chat room? We want this to be as participative as possible. We're really interested in hearing what works for you, what are the challenges for you. But also, if you're not in the chat room, why not tweet using #EdgeTalks or the handle @HorizonsNHS. So we're going to be keeping an eye on what's happening in the on Twitter and feeding that back into the session later on today. So before I go any further, I just want to introduce Bev Taylor, and she's such a fascinating woman. For anybody who hasn't met her as yet, she's great. She's very passionate about what she does. She comes from a very interesting, very varied background, definitely rooted, I would say, into the voluntary sector, but has been working as a connector, as a leader on social prescribing for such a long time. She brings a lot of wisdom and practical wisdom to this agenda. So I'm going to hand over to Bev, and she's also brought with her a team of other people, Debs Taylor, Sarah from the York CBS, as well as Jenny Neff. So I'm going to hand straight over to you, Bev, to take it from there.
Okay, I'm just checking that you can hear me, Janet.
I can hear you, Bev.
Brilliant. Okay, fantastic. So I'm not sure I can follow that great introduction, but I'll do my best. Okay, so I just want to take you through just a little bit of introduction, and then I'm going to hand over very quickly to Debbie Taylor, who is going to tell us about her life experience and what social prescribing really means. Janet, can I just check, can I just put my slide forward, please? The next slide. Let me just check that bit. Okay, so we want to share thinking about social prescribing. We want to hear how it is on the ground. We want to think about how we can build the movement, and we want to hear from you. We want to hear from everybody, and we're already starting to do that, so that's great. Okay, so from my perspective, a lot of people tell me they hate the term social prescribing, and I get that. I can see that it sounds too medical, but it is currency. It is what people are talking about all the time. But for me, it's about connecting people for well-being. It's about enabling people to connect with each other. It's about link workers who can give time to people. If you think GPs don't have the time, they've only got that 10 minutes. But the people who've got much more complex needs, who are struggling to manage long-term conditions, who might be lonely or isolated, the GPs can refer to a link worker community connector service. If you see at the bottom in the yellow box, we see the community connector services that employ link workers as being absolutely essential to building this across the country. So this is about, we've got to be really clear, this is about a power shift. This is about supporting people to take control of their own health and well-being. It's not, we're moving away from that medical model of, you know, doctors do stuff to us. This is about us being in control. And it's about a shift away from traditional services. Of course, we still want the traditional services, but we know that really we want community as well. We want a life. We don't just want a service. We want to be able to connect with our neighbours. We want to be able to support each other. If you think about Grenfell Tower and all that horrible stuff that happened around terrorism this summer, people are really quite desperate to help each other. People love mucking in and supporting each other through community. And social prescribing is about how do we do that when we don't have those horrible disasters, when we do it the rest of the time. Okay, so one key element for me is that this is about co-production, so that when the person sits down with a link worker, they can work, the conversation is based on what matters to me, what am I struggling with, what are my priorities, so we build a plan that's about that makes a difference to me. Last bit from me before I hand over to Deb. So you all know this, you're all building this, but this is an asset-based approach. It's about looking at what do we already have in a local area, how can we build it together, how can we get rid of those unhelpful hierarchies between statutory and voluntary, between paid and unpaid, and how can we build a shared approach together, because everyone is needed if we're going to change that traditional model. I suppose there's one key thing for me, which is about we can't expect the voluntary and community sector to receive a huge number of referrals through social prescribing for free. That if we're doing a small pilot, if we're looking at 1 or 2 GP practices, it might be, you know, it is appropriate to start off small and build it up. But some areas, social prescribing is across the whole of general practice in Leeds, 3 CCG areas, 105 GP practices. Everyone is referring to voluntary and community sector, and we can't just expect that voluntary and community sector to absorb all that extra work and all that extra support without being supported themselves. So that's a really clear message from me. And I'm going to hand over now to Debs Taylor from Creative Minds, who's going to tell us about her experience.
Thank you for that, Bev. I've been in the mental health service from the age of 8. I've got used to people telling me how to live my life, what I need to do and how I need to respond. And that's pretty much the norm from when I was growing up, how it was meant to be. And having done that, you just get used to that. You don't know any different. It's not something that, you know, you think is possible. I was told by one of the experts that I would always be ill, I would always be medicated, and I would never work again. Now, when you're at your lowest ebb, and this is what the experts are telling you, that this is the best your life is going to be, there's not very much hope out there, is there? There's not very much to look forward to, or to have any sort of existence or happiness in life. So I took an overdose 7.5 years ago. I'd just lost my mum and we had another major issue in the family. And I was at the lowest ebb any one person could be. And from taking that overdose, I was referred to see psychological services. Now, I'd seen them before, countless times. I've been in the system 40 years. I've done lots of services and treatments and therapies along the way. But while I was sat in the waiting room for the assessment for the psychological services, I saw a leaflet, Creative Minds, Art for Wellbeing. I'd never done art before. I don't know why on earth I picked the leaflet up, but I picked that leaflet up, and It just opened up so many new areas for me. It gave me a life, it gave me an existence, but more importantly, it gave me an identity. I didn't feel like I was just a Rio number anymore. I wasn't just a patient. I was somebody who belonged, who had meaning and purpose, which is something I'd never experienced before. It was really unusual to feel this fire. I call it fire in my belly. It was, you know, something that just got onto me. But what annoyed me was the fact that this professional had said this to me. And it got me quite angry. And I started doing talks on giving people a hope, saying, you know, they might be an expert, but they don't necessarily know what the full answers of everything. Maybe we can find them in ourselves. And through the art, I started learning more about myself than I ever thought possible, really. The journey I've been on has been absolutely incredible. It's just been wonderful to see and feel and belong. Now, I was at an event in Birmingham yesterday, and we were talking about evaluating social prescribing. How do you evaluate? Well, in the 6.5 years that I've been doing the art project, I've gone from being on 21 tablets a day, bedbound for quite a lot of the time through my mental health, and my children were my carers. I've been off medication for 5.5 years. I've been out of services for 2 years, and I now work in the same trust that NHS expert told me I'd never work again for, which is always interesting on the corridors. But it's about the life it's given me, the existence, the being of me and how I am and what my life is like. You can't put a price on how my life is now to what it was then. I'm off benefits for the first time in 14.5 years, having been medically retired due to mental illness in my previous job. The impact to me, I do the talks, like I say, initially it was to service users to inspire hope, but then the professionals started listening and asking me if I'd do talks at their events. Well, to me, it's about educating people. We need to tell people that, you know, there are good things out there and we need to use them. We need to make use of them. We need to offer people more choice and more options. I'm not saying the art is a service that works for everybody, because it doesn't. I work for Creative Minds, which is a charity hosted by South West Yorkshire NHS Trust, which is a mental health trust. And it's a complementary service. And that's all we're asking people, is to look at different options for people. Let's look and find and seek what we can get out there for people to get them to think differently, to act differently, but most importantly, to empower them to deal with their problems and their issues, because who knows that problem better than the person who's living with it? If we can empower them to think differently and think maybe that they can make themselves better and have confidence in their own ability, certainly in the mental health trust, that they don't give you that trust, they don't give you that ability that you can manage your own condition. Well, as somebody who's done an art class, who's now managing very well their own condition, I'd like to dispute that and say art has been a wonderful service for me, a lifesaver even. You know, this art class did save my life. It's absolutely incredible. The picture on the screen is from one of the talks I did. I was asked if I would like to go for tea with the Queen. I initially turned it down because I thought he was taking the Michael out of me, but it's just showing you what is possible if you're given the chance and the options and the different areas that you can work in. Social prescribing is just another option. It's one of the options that to me has been a complete lifesaver. The benefits to me have far outweighed any other service or treatments or therapies that I've been involved in. And it's so incredible to have that identity, to be that person. And just one simple art class, it transformed my life beyond anything I ever expected, I ever dreamt of. You know, who'd have thought 7 years ago, when I was laid up in bed on 21 tablets a day, absolutely zombified on the really serious heavy medication that I was on, that I would be invited to go to Buckingham Palace, that I would be there for tea with the Queen, that I would be asked to talk at the King's Fund and to meet Prince Charles. And it's about giving people that hope. You know, I'm not saying everybody can have such a wonderful journey as what I've had, but that we can improve their life a little bit, that we can make their lives that little bit better and understand themselves and their conditions and make it happier and more enjoyable to be them. Now, sorry, I've forgotten where with time. I hope I haven't gone over. But I just want people to see that, you know, we are all on a journey. We all need things to help and to inspire and to be us. And if we can do that by social prescribing, then that is brilliant. And just before I go, I want to just add on there about, we did a little poll earlier about funding. The NHS were paying £2,500 on my medication for each year. £2,500. That doesn't include any of the specialists I saw. It doesn't include any of the counselling or any of the other treatments, just my medication. The art class that I went to with Creative Minds cost just less than £2,000 for 2 years. So we're already saving money. So even if you have to put a little bit in, it does work. I mean, if they're saving £2,500 a year, just on my medication, not on any of the other services, you can imagine how much the NHS are now saving because I found a simple art class that transformed my life. Thank you very much. I'm not sure who I need to pass on to now.
Okay, Debs, that's fantastic. Thank you for sharing your story. You always blow me away, and I'm sure everyone else will also feel blown away by your courage and your amazing leadership. So I'm now going to pass on to Sarah Armstrong from York CVS. Who, oh look, there's Debs meeting Prince Charles at the King's Fund conference. I am going to pass on to Sarah Armstrong, and Sarah's going to tell us about the reality of running a social prescribing connector service. Sarah, take it away for us, please.
Brilliant. Thank you very much indeed for the opportunity, and it's absolutely fantastic to be part of this today, to be able to tell you a bit more about our local service here in York. So our local service here in York is called Ways to Wellbeing, and I think the very simple explanation of this is that it's about finding the right way to well-being for people. And as we all know, I'm sure, it's a different way for different people and also at different times in their lives. So in the 10 minutes that I have, and I'm very aware of time, I want to tell you 4 things about our journey along the path of Ways to Wellbeing here in York. So I want to tell you a little bit briefly about how we got started. I want to share some highlights and some challenges, and then to finish by saying how we know we're making a difference for people, which neatly leads on to our future pathway for Ways to Wellbeing. Now, getting started for us, there were absolutely 2 key elements that we couldn't have got off the ground without. The first one is that we have an amazing GP who leads a group of practices, and she believed that this would give patients something different and something that GPs couldn't or shouldn't provide, and she gave us access to everything. All of her lovely GP colleagues, a space, access to systems. She helped us develop the model, and she stood alongside us when we were trying to explain it to people who didn't quite understand what this was all about. And she continues to be our biggest champion for this service. We are absolutely so lucky to have this relationship with her. The second bit, and it already relates to the poll and to what's been said already, was that our local authority provided some funding. And again, it was a bit of a leap of faith, but they also shared the belief that this might make a difference for people. And all this happened just under 2 years ago. And in that 2 years, there have been many, many highlights. It's actually really difficult to pick some, but I just want to quickly share 3 with you. And the first one is about the number of people who've been part of this service. So we've had over 220 referrals so far. We've been operational for about 18 months because it took a bit of time to develop the service. But in that 18 months, we've had just over 220 people being part of it. And when we first started and we went to practice meetings and we were trying to explain this to GPs, we were using theoretical case studies. So we were saying, you might see a patient and these are the kind of things that they might be sharing with you, and you might want to offer something different, and this is then how it would work, and then this is what we would do. But it was all theoretical because we didn't actually have any cases at that stage. But the last GP practice that we embedded ourselves within, as soon as we arrived, we didn't even have to do any kind of introduction. They said, we've heard who you are. It's brilliant that you're here. Tell us how we can do this. So because we now have case studies that are real and are not theoretical, and everybody knows about the work that we're doing, it's much easier to convince people that this is an alternative option. The second thing I want to share is about something that we lovingly call breeze boxes. Now, we had loads of stuff donated, everything from bath bombs to mindfulness, colouring, and starter packs. And we thought, what a lovely way to introduce people to the service if we made up some breeze boxes with all these lovely items in that can help people just feel a bit de-stressed, maybe a bit pampered, can get creative. Wouldn't that be a great thing to do? And sneakily, it enabled us to introduce volunteering to this service. So people who'd been part of this service, who'd had access to it, then could volunteer for us and make up the breed boxes and give them out as the introduction, which is a lovely way to then participate in the service differently. And the third highlight is that we've just undertaken a really thorough review with one of the lead IT people for a group of practices. And we focused on around 150 patients who each have access to around 10 GPs between them. And we focused on how many GP appointments they had made and attended in the 3 months before they started with Ways to Wellbeing. And then immediately after the service has ended for them, that 3-month period, we compared how many GP appointments they made and attended. And in that very short period of time, there were 30% less appointments made. So when I talk about a simple thing like a breathe box, this is the difference that it makes for people. Now I'm going to just move on to challenges. And I want to talk about funding. I want to talk about funding in 2 ways. I want to talk about funding first of all in the sense that everybody believes in this service in York, everybody talks about it. I constantly do talks like this, and it's an easy sell because everybody's persuaded about the benefits. However, persuading them to be able to fund this, and we do have quite a challenged financial economy here in York, has been a different matter. And what we have done is introduced a mixed funding model where we ask for smaller amounts so that it can be bought directly into communities locally. So across the 21 wards in York, we've been to every single one of those ward meetings and said, how about buying into this locally? We've also found other funders who are interested in developing this, so it's small amounts that collectively put together can sustain this service, but it has been a long journey, and even though we are having success, it has been difficult. The second bit about funding is for our voluntary and community sector, and this has already been mentioned. We are a connecting service, but if we find somebody who needs help, we can't just add to other people's waiting lists. It doesn't make sense. So this has to be funded in two ways, not just for us to coordinate and develop this service, but also for our voluntary and community sector who extend their waiting lists and enable people to get the service and support when they need it. We have to be able to better fund them in order for this to be successful. And then moving on to what difference we believe our support has made to people's lives here in York, I want to very quickly tell you a story which is essentially 4 lines. It's a very quick story. So someone was referred to us. They had a lot going on in their lives, and over a cup of tea, they told us much more about it. And we supported them to get a benefits check done. This lady was awarded attendance allowance, and from this, we helped her to find a cleaner. Now, at this point in the story, you might be thinking, well, what difference does that make? But the really important point here is that she'd fallen last time she tried to do her hoovering and was absolutely terrified about what that meant. And what this did is it gave her back her confidence to live in her own home. But also, if you think about this from a system point of view, it absolutely avoided future hospital admissions and related services. And all of the 220 odd people that we've met have told us that life can be overwhelming for them. And I think everybody who's listening today, we all know that life can be overwhelming for all of us. And sometimes we know what help is available to us, but actually making that connection is really difficult. And you just need a helping hand along the way sometimes to be able to get that. So in my final minute and a half, I'm keeping track of time, I just want to tell you a little bit more about what's next for us. Obviously, we have to secure more funding, and we have to do that because we want this to be citywide, and we don't want to say no to someone based on their postcode, where they live, or the GP surgery that they're registered with. We want to be able to say yes if they need a bit of help and support. We absolutely have to extend that funding for our voluntary and community sector, as I've mentioned, because we can't do this without them. And I really believe this is the key to a successful social prescribing service. We really want to grow the volunteering element, and especially for people who've been part of this service. We had a wonderful example of a lady who had serious mobility issues, who couldn't really get out of the house. And what she can do is call people who are wondering whether this service is right for them and say to them, I know you're thinking about this. I know life's a bit hard right now. And I didn't know if this was the right service for me, but let me tell you how it worked for me. And that peer support is an excellent way to be able to undertake volunteering and be part of the development of this service. And finally, this piece of data delving that we did to look at the use of GP appointments, we know within that post 3 month period after receiving Ways to Wellbeing services that the appointment usage was a lot less. What we're really interested in now is, in a year's time, what will that be like? In 3 years, 5 years' time, what will that be like? So not just measuring the difference now and the immediate future, but actually in the longer term for people who use this service. And thank you very much for listening.
Okay, Sarah, that was brilliant. That was really, really, really helpful for me and hopefully for everyone else. What I got from that was two things. One is the fantastic statistic about 30% less appointments. That is consistent with an evidence review that the University of Westminster has done, which is published, which shows that where social prescribing is working effectively, where there's a connector service like what Sarah runs, that there is on average 28% less GP appointments as a result, and 24% less attendance at A&E. That for me is a key measure, a key piece of the jigsaw in making the NHS sustainable. But the other thing that you said, Sarah, which people have been commenting on, is about, it's the little things. It's the small things that enable people to get involved, that stop them from being a passive recipient of services to being someone who can give back and support each other. For me, that's the power of social prescribing. That's why we're all doing this, and that's the difference that we can make, which Debs is right, it's hard to measure, but it is really, really significant. Right, I'm going to hand over to Jennifer Neff and Leeann from Elemental Software. They've been building social prescribing in all kinds of ways and building digital platforms. So tell us more about it, please. And I'm going to mute myself.
Hi, before we go to Jennifer, I wondered if we can just quickly hear from Twitter, Lee, as to what's happening there, and try to bring in our wider audience to hear, you know, how is this conversation resonating with them. So just quickly over to you, Lee.
Good morning, everyone. Thanks so much for a really fantastic talk. On Twitter, people are really enjoying Deb's talks, really inspired about hearing about how art helped you, Deb, and they're really, people are really interested in hearing about the power of social prescribing in helping patients take the power back for them. So people are really getting involved in that. There's one good quote that I saw, just bear with me, that people were saying that you know, it's outstanding in terms of the reduction in GP appointments and people not being afraid to try something new, which is really, really good. It's about transforming conversations and finding new ways of doing things. So keep it coming on Twitter, use the hashtag EdgeTalks. Thank you.
Thank you so much, Lee. So straight over to you, Jenny. We look forward to hearing what you've got to say about your platform. Over to you now.
Okay, thank you. Thanks very much. So yeah, I'm Jennifer Neff, and Leeann Monk is joining me as well. We're in two different locations at the moment, but we are coming at social prescribing from a community voluntary and social enterprise background, having spent 15 years in supporting communities in enhancing and improving their health and well-being. And today we want to share our findings around social prescribing, talk a little bit about our own experiences and how that shaped what we're doing today. And we also want to share with you what we've learned. So we've spoken to so many different people. It must be nearly 1,000 people now over the last 4 years to really understand the challenges that they're facing in and around social prescribing. So it's all the different stakeholders that are involved in social prescribing, and we really listen to them. We listen to what the community says needs to happen. We listen to the health and social care professionals. We also listen to the providers, the community providers. But also we've realised that there's so many other stakeholders out there, like housing associations, local authorities, and they all have a lot to bring to the table, but they also face challenges in trying to support their communities. So in doing that, the digital side of things now, in our own experience, we just, as being community development workers, we just realised that digital does have a role to play. It can't be the dominant force whatsoever, but it does have a role to play in it, because you just can't forget about that face-to-face encounter. But there are so many administrative tasks associated with the actual social prescribing process that we just thought, let's see if we can try and make this easier for the GPs, for the nurses, for the social workers, for the link workers. The link workers and social prescribers are so much paperwork to go through. Also, let's see if we can make it easier for the communities, you know, because everyone starts a program or a service with the best intention in the world, but life happens and it gets in the way, and things happen, and sometimes it means that you might have started you know, a walking group, but after 2 weeks, you know, you're looking after your grandkids, and you know, you're not able to attend that walking group on the Tuesday night anymore. But you know, is there a way to try and keep that person engaged and say, look, well, it's actually on a Thursday as well, and for that person to say, right, I'll give it a go. But it's also about giving flexibility for people and understanding that, you know, it's not easy. So everything that we've done, we've kind of built it into this platform, and it very much sits in the background of the conversations that within the process of social prescribing. So we're not coming at this with a hardline techie background. It's very much coming from a community background. So what I'll do is I'll just tell you a wee bit about kind of our own personal backgrounds. So Leeann would have been a programme manager in one of the Healthy Living Centres in Northern Ireland. It was in the Craigan estate in Derry. And Leeann, it started off as a porta cabin, and it's developed over the years now into a really fantastic facility right in the heart of the Craigan community. And so Leeann would have been sourcing funding, so she would have been writing the funding applications for the big lottery, Joseph Brown Foundation, Sports Council, Public Health Agency, to be able to run programs and services that were going to make a difference to people's lives. She would have had a whole team of people working with her as well. So people might have come in as volunteers, and then she would have helped them train up and getting you know, healthcare professional or healthcare community health backgrounds and qualifications. So it was an amazing facility that was run there. There was about, I think she was bringing in an annual, maybe about 500,000 a year in terms of trying to support these programs. But a lot of people were sending people her way. The community referrals were being made from the GP, and so she was able to see challenges that were going to be around that. At the same time, so she did this for 15 years. My background was helping communities to access digital skills. So it would have been like helping someone to learn how to use email, Skype and things like that. So it was a social enterprise that was given a little bit of funding, and I would have gone around all the community centres to see if we could find a little corner where people could come in, and I'd get a tutor from the local regional college, and then we'd get like maybe 20 laptops. But what we were trying to do there was be able to help the community centre and say, right, here's money towards tea and coffee and electricity, and look, if you're able to keep this group engaged right through the end, there's some more money for you as well. So it was a great little program. I was also working with a social enterprise around employability, helping them with people with their CVs and things. And then we also then got City of Culture then in 2013, and this is where the cultural program was coming to our city in Derry. And we realised it couldn't be all about the big shiny theatre. It had to be happening in the grassroots level in communities. So I was helping getting money from the likes of BT, and Crown Paints were giving us paint and anything that we could get. So we've always had that kind of background in terms of supporting communities. But when we first met, we didn't actually realise what we'd both been doing was social prescribing. So it was about 5 years ago. We'd met previously, but we only really got talking about 5 years ago. And we were like, wouldn't it be great if it just could connect up better? You know, if we could connect up all those amazing resources, that funding, that GP surgery and those people. And we thought to ourselves, look, there must be a way to do this digitally, because there was a big digital revolution happening in Derry at the time. So we set about trying to see what we could find out from people, because we knew there were so many different people involved in this. And with our community development principles at the core, we thought, let's go out and talk to people. Let's see what the key stakeholders are saying. So Leeann will just tell you a little bit about what we found from when we went out and do that process.
Hi everyone. Just as Jennifer had said, to date we've spoke to around about 1,000, just over 1,000 people involved in the health improvement supply chain around social prescribing. But before we built any digital platform, we knew ourselves that this would make a difference, but we wanted to speak to everybody involved. So before we even decided to build the platform, we spoke to over 750 different stakeholders. So we spoke to a number of health and social care professionals, we spoke to GPs, practice nurses, OTs, physios, social workers. And the main problems that they were saying is that, yes, we would like to use the social prescribing model of healthcare, but the main thing stopping us is that we don't have time to research what's available in the community. So if we had a platform that could show us that really easy and quickly, And then they also said that sometimes we do know what's happening on the doorsteps, but we're a little bit reluctant to refer because we don't know what quality assurance is attached to those programs and services. So if you had a platform that would incorporate that, that would really, really help us. And the main concern coming from them was that if we took time out of our 10-minute schedule, a GP, for example, sent a letter to a community centre down the road to refer an older person to a lunch club to reduce social isolation, there was no feedback coming back. They didn't know if that older person turned up to the luncheon club. They didn't even know if that community centre had contacted that older person. So they wanted some feedback mechanism built into a platform. And what we had learned by talking to the community and voluntary sector providers, large providers, smaller providers, volunteer-run providers, they were all echoing the same thing and saying that we need to prove that we're value for money, to give us extra kudos, to go back to our commissioners, to go back to our funders. And it's not just about the attendance registers, it's not just about the bums on seats. We want to prove that we're making a difference to people's lives. We know we are, but help us to have the evidence and go back to our commissioners. And we spoke to a lot of patients, residents in the community as well, and we talked to the commissioners as well, and they had the same issue. The health and social care commissioners were saying that we need the on-the-ground analytics to prove that these programs and services we're commissioning and as value for money. And the patients, what they were saying is that while the idea of a platform is good and it's helping us be better connected in our community, it shouldn't be the dominant force. And we agree with those patients that what we have here on a platform should only enhance and make social prescribing easier to scale. So that was the main findings. But when we looked at everything all together, what we had seen was all these problems stem back to a lack of an integrated system to help social prescribing be lifted to the levels it needed to be. Could you go on to the next slide, Jennifer? So after speaking to those 750 different people, we were confident that it was the right thing to do and the platform needed to be built to enhance and improve the social prescribing model of care. And the way we explain our platform, we like to keep things really, really simple. So we say that the platform is like the middleman and it connects everybody up. So you have your health and social care professional, and it'll depend what health and social care professional you want to play a part in the platform, whether it's a GP, the practice nurse, or the social worker. They have access to the platform, their own sign-in details and their own dashboard, and they can make an express referral to the community providers in under 60 seconds. The community providers are a social prescribing hub. Again, equally, the community providers have access to the system, have their own dashboard, and they can connect the patients, the residents, and the other programs and services that are happening in the community. And then the patients, they also have access to the system and their own dashboard. They help them keep track of what programs and services that they've signed up for, and also they track their journey. So to date, on our journey, we've worked with a number of key partners. Jennifer had said already, it's not just about the NHS, it's not just about the clinical commissioning groups. We say that everybody plays a part in this. So we're working with housing associations, we're working with local authority, we're working with a clinical commissioning group, a vanguard, and we're also working closely with the community and voluntary sector. So we have partners right across. And just to highlight two the key projects that we're working on at the minute, we're working on a great project in the northwest of England in partnership with Health and CCG and the Improving Me Vanguard. And it was really bringing the social prescribing model of care to their baby box innovation. So when the mommies get the baby box at the week 20 of pregnancy, they're also offered a social prescription, and their journeys is tracked from that point of referral using our platform. In Northern Ireland, we're working with the Healthy Living Centre Alliance, which is a large alliance that stretches right across the whole country. They're using our platform as the software of choice. So every resident that avails of a programme and service within any of the Healthy Living Centres will be offered a social prescription. It's well on the way. There's loads of people going through availing social prescriptions on a monthly basis, and we're on target by the end of the year for 28,000 people. They have availed of a social prescription through that network at the end of the year. That's just some of the stuff that we're working on. Jennifer, I'm going to pass you back over if that's okay.
Oh, I just jumped on there. So in terms of the future then, so it's all about making this as easy as possible for the people that are involved in social prescribing. So we recognise to do that, GPs need to, it has to be really easy for GPs, but as Leeann says, we recognise that It's not just, it doesn't always have to come from the GPs. And that's why we're delighted that some of the housing associations are saying that they are going to be making their own referrals for just, you know, maybe that there's people, some of their residents are maybe hanging out at their centres and for a long time, and one of their housing workers might be able to say, look, you know, what are you interested in? And they're able to use the platform to be able to sit with the person, and the person can see there might be a gardening club, or there might be an art class, or there might be a film making program that's happening. So that's sort of, that's really keeping us, we're delighted that we're able to try and alleviate the burden of the pressure on GPs. But we recognise too that we need to integrate in with the GP system. So that's a big one for us now. We should have an announcement pretty soon about that. We also realise that while it's great getting the health journeys, and you can see the health journey, you can see where the person has started on their baseline, you can measure anything, be it well-being, social isolation, diabetic risk, and you can see that journey and you can see that person, that risk reducing, but also we recognise that there's times where that risk is increasing and we can lever extra support as well. So we want to be able to tie it in now to around that return on investment. So that's another thing that we're working on. Where the reporting modules, so we recognise too that the social prescribers were telling us, look, if someone drops out after 2 weeks, you know, how do I know? Like, I know they're not there, but I want to be able to look at it as a cohort and see the people that are dropping out, and we want to be able to do something about that. We want to understand why they've dropped out of that program, and we want to offer them an alternative. So there's a reporting module too that we've built into the system that the social prescriber can filter and say, show me all the people that haven't attended now for the last 2 weeks. And that means they can just get straight on the phone and be, you know, finding out what's going on in people's lives to be able to see if there's something else that they want to do. Maybe it was too much starting off with the spinning class. Maybe they said, look, I think it's just, I want to start off with a walking group. So it's really, really flexible. We also just want to create like an app version. So it's a browser-based tool at the moment, but we want to have an app version so that people can keep track of their social prescriptions and get some push notifications as well, because that's what people have told us. They said, look, we kind of need reminders here. If there's any changes to anything, we want to know that maybe a class isn't happening, rather than us going to the effort of turning up. And really it's all about just continuing the mission, because we're all on this mission together to mainstream social prescribing. We realise that we can't do it alone. We could, but it wouldn't be as effective. So we want to work with as many people as possible to be able to do this. And yeah, so we're just come and chat to us and see what we can find out more about your programs and see what we can do.
Okay, thanks for that. That was really, really helpful. And Jenny, I'd like to just pick up on that last bit, which is about we can't do it on our own. It wouldn't be effective. We are all building this social prescribing movement together. We all need each other. Everybody from different perspectives, whether paid or unpaid, we all are leaders and we all need to build this. And I just put a little message up saying, oh, and by the way, we're not stopping till social prescribing is everywhere, because we know this works. So we've got right now the social prescribing team at NHS England is just me, but we are
Are you there, Bev?
Can anybody hear me?
Yeah, I can hear you.
Brilliant. Sorry about that, don't know what I did. Okay, so right now the social prescribing team at NHS England is just me. On Monday there will be a couple of vacancies. One is for a development manager to lead the common evaluation framework. We are committed to building a common framework for measuring the impact of social prescribing. For me, my hunch around commissioners is that they really want to hear the things that Sarah was talking about, reductions in GP consultations and also reductions in A&E attendance. But there's also key measures around the impact on the person and what difference it's made to their lives, and also about the impact on community and how we're building resilient communities, which has to be part of the mix. This is broader than health. This is not just about health. This is about changing the relationship with the individual and services so that people are partners. They're not just passive recipients. I've got on the slide a statement from our next steps document. We want to work collaboratively. We've got a commitment to work collaboratively with the voluntary sector and primary care to build a systematic and equitable approach. So we want to spread social prescribing across all GB practices as quickly as it is practical to do so. That's our aim, and that's what we're working towards. But people are right to say this is not just about general practice. This is about everywhere. So hospitals, allied health professionals, housing associations, social care, we are all part of this. We can all refer and connect people in. I've got just one, I think I've got maybe one or two last slides. Janet, can I just move on, please, to the next slide? Okay, so I think I've said this, but just to say that the Department of Health Social Prescribing Fund, which is, it's only 5 million, but 5 million is a helpful start, is open now. It closes on the 21st of November. It's aimed at voluntary and community organisations who want to build those connector services like what Sarah talked about. The funding is, it's a 3-year programme, but the way that it will work is 100% funding in year 1, but you need partnerships with CCGs, with local authorities, with local partners, so that they agree to pick up 50% of the funding in year 2 and 80% of the funding in year 3, so that we build sustainable programmes, and so that we're not just coming to the end of a programme and saying, right, who's going to fund it? So I want you to really encourage you to look at that. Can I just move on? Jana, is that my last slide? Have we got anything else? Okay, yes. So there are regional social prescribing networks across the country. The next meeting is in Liverpool on the 28th of September. I'm afraid it's full, but we are looking at other events around the country. We are working with SDPs, with CCGs, with accountable care organisations. Here's a statistic for you. 75% of the SDPs, the transformation plans, have identified that they want to do social prescribing. Of the 6 that haven't mentioned them in their plans, I know that at least 4 of them are working on social prescribing because I've been talking to them. So we've got all the transformation plan areas looking at social prescribing in one way or another. We need to build the linked worker model. That connector service is core, because it's about taking the pressure off the NHS, giving people time, making people feel that they're important and that what they think matters, and enabling them to build the support that they need, just as Sarah has explained. And yes, we absolutely have to build the evidence base. Janet, is there a last slide? I think there might be a last slide that connects people with the, oh yeah, said all that, don't worry. Next slide, please. Okay, that's it, yeah. So if you want to join the network, Social Prescribing Network is growing all the time, more than 1,000 members. It's free at socialprescribing@outlook.com. It's just an email address. But you will get a regular monthly newsletter that will give you lots of events and things, and let's build it together. So I think, Janet, do we have time just to check in with Twitter and to check in with anybody's questions? We've got just 5 minutes, I think.
Yes, let's go over to Lee first of all, and then we'll take it forward in terms of looking at what's happening in the chat room. Over to you, Lee.
And then, sorry, I just had to unmute myself there so you can hear me furiously typing away on Twitter. Yeah, there's been some really interesting talk there, so thank you very much. People are really interested to hear, what's possible and what is working, and we're really keenly absorbing all of the really interesting information and evidence that you've been sharing. So thank you very much. It's been really, really interesting and inspiring talk. Thank you.
Thanks, Lee. So back over to you, Bev. I just wondered if we could bring in the other panelists as well, Debbie Taylor, Sarah, and really talk about in a couple of minutes this last thoughts really on this subject. It seems like in the chat room there's a lot of talk around how we can actually get more funding available, working better across the sector and with the system to make this much more sustainable. I just wanted to hear people's views on that.
Okay, anybody?
I work for...
Debbie, go for it.
Hiya, Bev. Can you hear me?
Yeah.
Hiya. Well, I work for Creative Minds, which is a charity hosted by an NHS trust. And we look at creative approaches, and we fund projects. We like to call them projects. We like to use the term projects rather than social prescribing because we find that's too medical and we want to try and get away from medical. And it's looking at what people are good at, what can you do, what gives you life, what gives you happiness and what gives you joy. And I know we are trying to spread the word and make it so more people can look at different ways of supporting social prescribing and getting the message out there. If it's in other areas, then absolutely fantastic. I was at a great event yesterday where there was lots of other areas doing very much the same thing. I think we need to try and link up better though. That's my final point.
Okay.
Thank you so much.
Thank you for that. Anybody else? Any other panelists?
Yes, could I please make a comment? It's
Sarah. Go for it, Sarah.
From CBS in York. Brilliant, thank you. I was thinking of exactly along the same lines as what Debs has just said. And it's the point that I was emphasising in my talk about the fact that if it's happening in a locality, it needs to be joined up. And it's hard to do it, but you need to get everybody on board so that everything is consistent from the messages about what the service really is and what's going on locally, right through to how people are able to access it and be part of it. And I think often when we start these services, we join up with a few partners, the people who we work really well with, and we know that we can deliver things together with, but just there's something really important about viewing the locality as a whole and getting everybody on board as best as possible.
Okay, thank you for that. That's really, really helpful last word. Okay, so I'm committed to working with anybody who'll talk to me and across government. I'm at Expo on next Monday, Tuesday. There will be a social prescribing stand in the primary care zone, so come and talk with anyone who's at Expo. And I think we should do more of these. I'm committed to trying to answer everybody's questions and to coming back to you. And I just want to say a real thank you to Janet and Paul and colleagues for making this happen today. So thank you, everybody.
Thank you, everyone. Take care.
Thank you. Thanks for inviting us.
Yeah, thank you.
No problem.